Everyone who works in this hospital wants to offer the best and the safest possible patient care. And everybody knows that hand hygiene plays a very important role in that care. Every healthcare worker knows that we should clean our hands in the right way. At the right time, throughout the day. The question is, how do we turn what everybody knows into what everybody does? We need you to help us find the answers to that question. That's why your hospital will be part of a pilot to test and evaluate a new program focused on improving hand hygiene. There is a way to protect yourself, your family, and your patients. A new multifaceted program with a clear message: just clean your hands. Healthcare-associated infections are in the news.
Reports regularly highlight the increased incidence of antibiotic-resistant organisms, such as MRSA, VRE, and Clostridium difficile. Healthcare-associated infections negatively affect patient outcomes. Isolation negatively impacts the patient's hospital experience. And these infections can leave patients with long-term health problems. They also drive up healthcare costs through increased patient length of stay, longer wait times for admission, and increased treatment costs.
How do we turn something that everybody knows into an action that everybody does? You and your facility are going to play an important role in the solution. This is one of 10 hospitals from across Ontario chosen to participate in the pilot program.
The Just Clean Your Hands program has been developed to improve hand hygiene by healthcare workers. It seems like a simple thing to do, but research has clearly demonstrated that improving hand hygiene is not simply a matter of telling people what to do. We want to address the enablers that promote hand hygiene, and Just Clean Your Hands is much more than a new slogan or poster. It's a multifaceted program that will make a difference in better hand hygiene. We're working with global experts and bringing in the best practices from around the world, including the United States, Switzerland, the UK, and the World Health Organization. We will evaluate what works and listen to you on how best to implement these changes into daily work practice. And the feedback will be incorporated into the provincial program. The input you provide us is valuable.
The Just Clean Your Hands program will need the active support of each one of you, no matter where you work and no matter what role you play in health care.
Cleaning your hands between patients and keeping the skin on your hands healthy reduces transmission of microorganisms. Yet, most healthcare settings report less than 50% adherence to hand hygiene. A recent Ontario study found that the average hand hygiene compliance rate in Ontario is 32%. Healthcare workers are just not cleaning their hands as often as recommended by the guidelines. This pilot program will help us learn what works well and what needs to change before the Just Clean Your Hands program is rolled out provincially.
We want to know how effective this program is in changing the behavior of healthcare workers and patients, how it increases the number of healthcare workers who consistently practice proper hand hygiene, and which components of the pilot are most suitable for the province-wide program.
Scientific evidence, not just opinion, demonstrates that the bacteria that causes infections in hospitals are most frequently spread from one patient to another on the hands of healthcare workers. If we can create a change in hand hygiene compliance in Ontario hospitals, we know that we will save lives.
Over the next few months, you will notice some changes. To help raise awareness among healthcare workers and patients, posters, brochures, and buttons all will communicate the message, just clean your hands. You will notice posters of people from your facility championing their commitment to improving hand hygiene. You may be asked to participate in surveys and focus groups. Patients will also be surveyed. You will see changes to placement of alcohol-based hand rub to make it easier to clean your hands at the point of care. Alcohol-based hand rub saves time, works quickly and effectively, and is easier on your hands. Your patients will probably be curious about this program, the posters and buttons and other material. We encourage you to interact with patients about the role of hand hygiene.
Hi, I'm just here to check up on you today. You'll see me cleaning my hands for 15 seconds before touching you. You may have received a brochure when you were admitted explaining that our hospital is part of the Just Clean Your Hands program. As part of this program, we'd like to encourage patients to remind healthcare workers to clean their hands.
Tell them about how you and your hospital are committed to keeping them free from infection, and that one of the best ways of doing this is to just clean your hands. Your patients will be reassured when you demonstrate proper hand hygiene before you touch them. It builds confidence that you are doing everything you can to protect them from infection. The program also features a web-based hand hygiene education tool, focusing on the scientific evidence and best practices.
The best international initiatives on hand hygiene have been incorporated into this important pilot program. This will be extensively monitored as we develop better ways to meet this challenge. The world is watching what we are doing to improve compliance, and the results from this hospital will play a critical role in our studies to improve hand hygiene. Thank you for doing your part.
Just by improving your hand hygiene, you can dramatically reduce the risk of patients acquiring infections while they are in your hospital. Help change what everyone knows into what everyone does. Just clean your hands. For more information, visit our website, www.justcleanyourhands.ca.